Hi, my name is Bjorn Landberg and I'm the founder of Illnessfinder. I'm going to give you a short introduction how the system works. So to start with, you have to enter the system. You have three options. First, you can just log in as an already signed up member. Second, you can just sign up as a free member. Third, you can click on diagnosis of illnesses and you are able to have a short overview how it looks like. I would just log in. As you see here, basically of all my systems, there are always 4 steps. So just read it carefully and I think you will be able to follow quite easily. But the first one, you have to choose between man and woman and age. Those you cannot skip. The other 2 options, blood type and risk factors, it's not necessary, but of course it will kind of narrow the findings, make it more possible to find the right one. I will start with a patient case I had for a while ago. It was a woman and she had the age of 27, and she came to me because she had infertility problems, and secondly, she had a very painful menstruation. As you see here, you can also click on, for example, M for menstruation, and then you can just click on menstruation pain. That could be helpful if you have some difficulties of writing it correctly and so on. The third one was she had a very heavy menstruation, a lot of blood. And as you see here, heavy menstrual bleeding. You can see here in brackets what you basically entered, and this is normally the Latin or the Greek medical term, so dysmenorrhea and menorrhagia. And now you have listed a few options. The first one is ovarian cyst, which was when she had took a CAT scan to see. You should be very aware of that those points are just indications, so even if there are many points in between here, for example, they could be the opposite. It could be endometriosis. So it's always important to do some more medical research. I mean, take some blood tests and so on. Okay, then I will pick a second patient case. This was actually a good friend of mine. Ironically, he is a doctor, and they didn't find his illness for several weeks. So he's a man of 59 at that time, and the troubling thing with this case was he had very general symptoms, basically influenza-like symptoms. So he had headache, high fever, cough, pain in throat, and his limbs were swollen as well. And he even had pain in abdomen. So it was, I think he went to 5 different doctors, and they basically came to the conclusion that he had a chronic sinusitis, influenza, common cold, allergies. But what you see here on the sample number 5 is something interesting, mononucleosis. But what they did finally, they took blood tests. So in the blood test, it showed that his ALAT and enzyme levels were very elevated, the liver enzymes, which indicated some kind of what should you say in English? Well, affection of the liver. And all of a sudden, you see that the mononucleosis is high up. And it was mononucleosis. But he suffered for several weeks. I think he even lost like 10 kilos of weight. So that was pretty unnecessary. As you see here, you can also read about different sickness. If you click on it, it will be linked to Wikipedia. This one I have to correct because you have to click another time for the kissing disease, which is what it was. Tricky thing here, which I will make more clear, is how to come back to your estimations. What you should do is just to click on diagnosis of illnesses. It will be a button here as well. But until then, click here. Then you come back. So it's the same thing here. You can read about the symptoms or medical findings. It's good if you have some kind of question mark what it is. But remember, click here. Okay, that was it. So remember, this is just educational. You shouldn't make your own diagnosis. It's very important to understand this. This is just a tool. It's nothing else. It doesn't replace doctors. They have a total different skill. But it's just more like an aid for the doctors and for the therapists. Okay, thank you for your attention. Bye-bye.